Good afternoon, everyone, and thank you all for joining us today. Welcome to our webinar, Boosting Patient Engagement and Practice Efficiency, a guide to high-performing GP websites. We know that practice managers and GPs like you are under immense pressure, juggling rising demand, staff shortages, and increasing digital expectations from patients. And with the NHS driving forward its digital transformation strategy, your GP website is no longer just a digital notice board, it's the front door to your services. Today, we'll explore how your website can support NHS best practice, practical ways to improve patient engagement, real examples of practices saving time and money, and the digital tools that are making the biggest impact across primary care. We've also prepared a free guide for all attendees, packed with insights and a step-by-step guidance. If you have any questions as we go, feel free to drop them into the chat on the left-hand side of your screen, and we'll cover them in the Q&A at the end. And I'll hand you over to Michelle Goldswain, our team lead at Silicon Practice, who will be taking you through today's session. Let's get started.
Thank you. Thanks very much. Thank you for that. So good afternoon, everyone, and welcome to today's webinar. So today we're going to be going through, as Lauren mentioned there, our document on boosting patient engagement and practice efficiency. So this is a guide to high-performing GP websites. As Lauren mentioned there, my name is Michelle, and I'm the account management lead at Silicon Practice. So I'm going to be guiding you through this session today, and we're going to explore how GP practices can enhance their digital presence to improve patient engagement and also streamline operations. As we know, or some of you may know, the NHS is rapidly advancing its digital healthcare agenda, and a practice's website is now more than just an online presence. It's the digital front door to primary care services. So with increasing patient demand on online healthcare services, having an optimized, accessible and secure website is critical. And by the end of the session, you'll gain insights into the essential features of high-performing GP websites, NHS guidelines for excellence, and real-world case studies demonstrating the benefits of digital transformation. We're also going to introduce a comprehensive guide that provides an in-depth view to providing GP websites, to improving GP websites even, and aligning with NHS best practices. If you do have any questions at all, as Lauren mentioned, please feel free to drop them in the chat, and we'll address them at the end of the session in the Q&A. So at the moment, the healthcare sector is undergoing a digital revolution. So according to NHS Digital, more than 28 million patients in England are now registered for GP online services, with over 90% of practices offering some form of digital access. And websites play a crucial role in modern patient interactions. So they're no longer just static pages, but actually interactive platforms providing self-service tools, appointment requests, repeat prescriptions, and access to health information. Research shows that up to 70% of patient interactions can be handled digitally, reducing administrative workload for practices by an estimated 30%. And I think the key question that we must ask is, are GP websites equipped to handle this kind of shift effectively? Many GP websites suffer from things like poor navigation, slow load times, and non-compliance with NHS accessibility standards, and it makes it harder for patients to be able to access those services online. An optimized GP website doesn't just improve efficiency, it also enhances patient satisfaction and ensures compliance with NHS digital transformation goals. So many GP practices are struggling with an overwhelming number of phone calls, leading to both long wait times, increased frustration for both staff and patients. According to NHS England, 45% of patient calls to GP surgeries are related to simple administrative tasks, such as requesting appointments or requesting prescriptions. So these are tasks that could be easily automated through well-designed websites. A study by the British Journal of General Practice has found that digital interactions reduce the number of unnecessary in-person visits by 25%. So that's freeing up time for GPs to do more critical cases and deal with more critical things. Despite these potential benefits, Many GP websites are outdated and difficult to navigate, and they lack integration with digital NHS services, so things like the NHS app. Furthermore, accessibility remains a significant concern. So an NHS audit found that over 60% of GP websites actually failed to meet the web content accessibility guidelines. So it was making it difficult for patients with disabilities to use their website effectively. These challenges highlight the need for a strategic approach to providing digital access and service delivery in primary care. To address these issues, the NHS England has established a 4-stage framework for enhancing GP websites. So these include planning, improvement, migration, and maintenance. And the planning phase involves assessing the current website's effectiveness, identifying the pain points, and setting goals based on patient feedback and operational needs. The improvement part includes implementing accessibility, usability, security, and functionality enhancements to ensure that the website meets the NHS digital transformation standards. Migration is critical for practices moving to a new website provider, and that ensures seamless integration with NHS services like the NHS app and also patient record systems. So the last phase focuses on regular updates, so things like security patches and performance monitoring to ensure long-term efficiency. By following this framework, GP practices can ensure that their website serves as an effective digital hub that meets both patient needs and NHS expectations. High-performing GP website, it must balance usability, accessibility, content, functionality, and also security. So for usability, websites must be mobile friendly, so it must have things like easy to navigate, it can load quickly, and studies show that 57% of users will abandon a website if it takes longer than 3 seconds to load, so that's quite a quick time. Accessibility, again, so we've got compliance with the WCAG guidelines, or 2.1 guidelines is essential. Features like screen reader support, keyboard navigation, and high contrast design, and they ensure inclusivity. So for content, websites should use patient-centered language, so NHS-approved templates, and also keeping health information up to date. And for functionality, patients expect a seamless online service, such as things like appointment booking, repeat prescriptions, NHS app integration, and secure messaging. And lastly, for security, compliance with GDPR, NHS protection with policies is crucial as well, and also features like encrypted forms, and that making sure that the portals are also secure, just to make sure that we're enhancing the trust and confidentiality for patients. Okay, so now we're going to have a look at some real-world examples demonstrating the impact of digital transformation on GP websites. So we've got 2 case studies here. So for case study 1, this was actually a GP practice in Glasgow, and they implemented our Footfall solution and saw a 30% reduction in patient call volumes within 6 months. And that was the integration of online appointment and also prescription requests. It led to a significant administrative time saving for that practice. We also have case study 2. So this was for an ICB in Black Country, and they saved over 34,700 phone calls or visits to its practices' receptions. I believe that was equating to roughly £72,973 in reception staffing costs. So in its first year, digitally serving over 1.26 million residents. So I think these examples highlight how an optimized website can improve efficiency, reduce workload, and also enhance patient experience as well. So Our guide, so it's called Boosting Patient Engagement and Practice Efficiency, and this is a guide to high-performing GP websites, and it provides an in-depth guide to digital transformation. It covers strategies for implementing NHS best practices, improving patient access, and also real-world case studies as well. The guide is designed to help GP practices make informed decisions about their digital strategy and enhance their online presence. You can download the white paper using the QR code displayed on this slide right now, or you can visit our website at siliconpractice.co.uk. We'll also send a follow-up email containing the download link for your convenience too, and we encourage you to explore the insights and the strategies shared in that paper as well to improve your GP practice's website. I just wanted to very quickly show you one of our websites, just so this is actually a live site of ours, just to show you how practice websites, what we've done when we built the website is to make sure that we're adhering to the benchmarking that was sent out by the NHS. So I'll just give you, see if I can show you this. Hopefully you can see that okay. But just to give you an example, so we've got surgery here. So as I talked about, one of our case studies in the ICB of Black Country. So we've got limestone surgery. So as you can see at the top of the page, we've got these clearly labelled tiles. And we've ensured to put in the 5 top items that the NHS have asked to show at the top of the page. So at the top of the homepage of each website. So we've got appointments, prescriptions, sick notes, test results, and register with us. So we've added those into the site at the very top, so it's nice and easy for patients to find. We've also added contact us, because this is also something that the NHS had added to the benchmarking to make sure that this was at the top of the page. We've put everything, as I said, in behind these tiles, so it's nice and easy to read as well. So the font sizes are all in what the NHS have recommended for their websites. We've added local and NHS services to the homepage of each site, so you'll always have the health A to Z's on the site from the NHS site, how to find your NHS number. Things like that. We've incorporated as many of the links really from the NHS site that we can, and obviously you can add more as well. So these websites are editable, so you can add any local links that you'd like to as well. So we've just made sure that as well in the footer, we've got all of the information that's easy for patients to find if they were to go to a different page. The most sort of visited links are at the bottom, so it's nice and easy for patients to find as well. So it was just to let you know of that. Our forms also are set out in the, I don't know if this, apologies if this, I'm just going to have a look if this has got one of our forms on it. So you can see at the beginning of the form, we've got the sort of red flag conditions, if you'd like, at the beginning, and then our forms are now set out in a much more sort of NHS look and feel than previously. So, so you can see it's nice and easy for patients to complete. So just to give you a little bit of background on what our sites look like. So as I said, we are making sure that we're adhering to the benchmarking that was sent out by the NHS. Okay, so let me just move on there. Okay, and so yeah, so really just to thank you really for attending our webinar today. Before we wrap up, I just wanted to give you some key next steps. So if you wanted to book a personalized consultation with our team, so you can do that if you'd like to assess your website's needs. So we're more than happy to go through that with you. If you wanted to reach out to us even for tailored support in optimizing your GP website, you can absolutely do that. But now just wanted to open the floor if you've got any questions in the chat at all. Lauren, I don't know if you've had any through.
Yes, we have had one come through. So this is, what's the best way to assess whether our current GP website meets NHS accessibility and usability standards?
Okay, so for that, I would recommend having a look through the benchmarking just to see that came out from the NHS. I don't know if we've got a copy of that right now to put in the chat. I don't know if I've got one available, but I don't know if you've got them there, Lauren. If not, we could send it.
We can follow up definitely as part of the follow up with the recording of the deck and the guide. I can send out a link to the NHS benchmark tool. That's no problem.
Excellent. So we'll follow up with that for you. So it's probably worth having a look through, just making sure that you've got all of the items that are in that benchmarking. But we're happy to help with that as well. If you need anything, you know, any help with that at all, please do let us know, because we're happy to go through it with you and help where we can as well on that. But yeah, that's
we've not had any other questions come through, Michelle. So I'm just double checking now.
Okay.
But no, I don't think there's any more questions for today's session. But anyone, if you do think of a question later on and you do want to follow up with us, that's absolutely fine. I'll be reaching out to everyone with a recording of today's session, a copy of the guide, and a link through to the NHS benchmarking tool. So please feel free to come back on that email if you do have any questions. I can forward them across to Michelle or somebody in the team, and I'm sure we can get you an answer. But thank you so much to everyone for attending today's session. Like I said, I will be following up with a recording. So if there are any colleagues that you think may find this session useful, please feel free to pass that along. And yeah, if you keep an eye on our socials, particularly on our LinkedIn, we will be launching more webinars in the future. But thank you to everyone for their time today.
Very much. Thanks.